Why is rapid seizure termination vital for status epilepticus? Imagine a situation where a seizure just keeps going and going without stopping. This is what we call status epilepticus, a serious medical emergency that needs quick action. When seizures last longer than 30 minutes or happen repeatedly without recovery in between, the brain and body can suffer serious harm. That is why stopping these seizures as fast as possible is so important. The main reason is to prevent permanent damage to the brain. During a prolonged seizure, neurons become overexcited, which can cause cell death and brain injury. This process is called excitotoxicity. The longer the seizure continues, the higher the risk of irreversible brain damage. Early treatment helps protect brain function and reduces the chance of death. Studies show that if seizures are controlled within the first few minutes, outcomes are much better and fewer people suffer lasting harm. Another key reason is to avoid systemic complications. When seizures involve the whole body, especially in convulsive status epilepticus, they can cause breathing problems, leading to low oxygen levels. Seizures also raise body temperature dangerously high, cause metabolic disturbances like acidosis, low blood sugar, and high potassium levels. Muscle breakdown, known as rhabdomyolysis, can occur, which may damage the kidneys. Heart rhythm problems can develop, and there is a risk of aspiration pneumonia if the person cannot protect their airway. Rapid seizure control helps prevent these life-threatening issues. Delaying treatment can also make seizures harder to stop later. If seizures go on too long, they can become resistant to medications, a condition called refractory status epilepticus. When this happens, more aggressive treatments like putting the person into a coma and using machines to breathe may be needed. These treatments carry their own risks and complications. Acting quickly with initial medications like benzodiazepines can often stop seizures before they become refractory, reducing the need for such intensive measures. Timing is crucial because early administration of anti-epileptic drugs is much more effective. Giving medications like benzodiazepines within the first 5 minutes of seizure onset greatly improves the chances of stopping the seizure. Waiting longer reduces the effectiveness and increases the risk of complications. Emergency protocols emphasize rapid intervention to improve survival and recovery chances. Quick seizure control also allows healthcare providers to perform necessary diagnostic tests. Imaging studies like MRI or CORT scans, blood tests, and EEG monitoring can be done sooner, helping identify the underlying cause of the seizures. This information guides further treatment and helps prevent future episodes. It also makes airway management and stabilization safer and more efficient. Guidelines from epilepsy and neurology experts agree that rapid seizure termination is a top priority. They recommend that treatment should begin as soon as possible, ideally within the first 5 to 30 minutes of seizure onset. This approach, sometimes called rapid and early seizure termination, aims to minimize brain injury, reduce mortality, and improve overall outcomes. In summary, stopping seizures quickly in status epilepticus is vital to protect the brain, prevent systemic complications, avoid treatment resistance, and improve survival chances. Immediate and effective management within the first few minutes can make a huge difference in the patient's recovery and quality of life. Always remember, if you or someone else experiences a seizure that lasts longer than 5 minutes, seeking emergency medical help immediately is essential. Consulting healthcare professionals for personalized advice and treatment is always the safest course.